Fundamentals of Nursing Advanced Practice Questions. Question 1. Which of the following techniques involves the sense of sight? Inspection, palpation, percussion, auscultation. The correct answer is inspection, choice A. Question 2. What is the initial technique used when examining a client's abdomen? Palpation, auscultation, percussion, inspection. When examining a client's abdomen, the initial technique used is inspection. Question 3. Which technique in physical examination is used to assess the movement of air through the tracheobronchial tree? Palpation, auscultation, inspection, percussion. Auscultation is a technique in physical examination used to assess the movement of air through the tracheobronchial tree. Question 4. Which instrument is used for auscultation? Percussion hammer, audiometer, stethoscope, sphygmomanometer. Auscultation involves listening to internal sounds in the body such as heart and lung sounds. Question 5. What is the best description of resonance? Sounds created by air-filled lungs. Short, high-pitched and thudding. Moderately loud with a musical quality. Drum-like. Resonance refers to the quality of sound produced by vibrations that are reinforced by other vibrations of the same frequency. Question 6. What is the best position for examining the rectum? Prone, Sims, knee chest, lithotomy. The knee chest position is the most optimal position for examining the rectum. Question 7. What term refers to the manner of walking? Gait, range of motion, flexion and extension, hopping. Gait is the correct answer because it specifically describes the pattern of movement of the limbs during locomotion, particularly walking or running. Question 8. The client was asked to read the Snellen chart. Which of the following is being tested? Optic, olfactory, oculomotor, trochlear. The Snellen chart is a standardized tool used to assess visual acuity, which is the clarity or sharpness of vision. Question 9. What is another name for the knee-chest position? Genudorsal, genupectoral, lithotomy, Sims. The knee-chest position is correctly identified as the genupectoral position. Question 10. When preparing to administer an IM injection that is irritating to the subcutaneous tissue, what is the best action to prevent tracking of the medication? Use a small gauge needle. Apply ice on the injection site. Administer at a 45 angle. Use the Strack technique. The Strack technique is the best action to prevent tracking of the medication when administering an IM injection that is irritating to the subcutaneous tissue. Question 11. What is the most appropriate nursing order for a patient who develops dyspnea and shortness of breath? Maintain the patient on strict bed rest at all times. Maintain the patient in an orthopneic position as needed. Administer high-flow oxygen immediately. Encourage the patient to engage in vigorous physical activity. Maintaining the patient in an orthopneic position as needed is the most appropriate nursing order for a patient experiencing dyspnea and shortness of breath. Question 12. A nurse is providing teaching about gastrostomy tube feedings to the parents of a school-aged child. Which of the following instructions should the nurse give? Administer the feeding over 30 minutes. Place the child in a supine position after the feeding. Change the feeding bag and tubing every 3 days. Warm the formula in a warm water bath before administration. Administering the feeding over 30 minutes helps prevent complications such as aspiration. Question 13. When administering digoxin 0125 mg/PO to an adult client, for which of the following findings should the nurse report to the provider? Potassium level 42 MEQL. Apical pulse 58 minutes, digoxin level 1 ng/ml. Constipation for 2 days. Monitoring the digoxin level is crucial as it helps determine the drug's effectiveness and potential toxicity. Question 14. When a client is comatose and has advance directives stating a desire to avoid life-sustaining measures but the family wants these measures, what action should the nurse take? Arrange for an ethics committee meeting to address the family's concerns. Support the family's decision and initiate life-sustaining measures. Complete an incident report. Encourage the family to contact an attorney. In this scenario, the nurse should prioritize the client's wishes as outlined in the advance directives. Question 15. A client who wears glasses is under the care of a nurse. Which of the following actions should the nurse take? Store the glasses in a labeled case. Clean the glasses with hot water. Clean the glasses with a paper towel. Store the glasses on the bedside table. It is essential for the nurse to store the client's glasses in a labeled case to ensure they are kept safe and protected from damage. Question 16. When caring for a client who is on contact precautions, which of the following measures should the nurse include in the teaching? Remove the protective gown after leaving the client's room. Place the client in a room with negative pressure. Wear gloves when providing care to the client. Wear a mask when in the client's room. Contact precautions are used for clients with known or suspected infections that are spread by direct or indirect contact. Question 17. A client is recovering from an acute myocardial infarction that occurred 3 days ago. Which of the following instructions should the nurse include in the care plan? Perform an ECG every 12 hours. Place the client in a supine position while resting. Draw a troponin level every 4 hours. Obtain a cardiac rehabilitation consultation. After an acute myocardial infarction, cardiac rehabilitation is crucial for the client's recovery. Question 18. Which of the following conditions in the client's history is a contraindication to the use of oral contraceptives? Hyperthyroidism, thrombophlebitis, diverticulosis, hypocalcemia. Thrombophlebitis, which is inflammation of a vein with the formation of a clot, is a contraindication to the use of oral contraceptives due to an increased risk of thromboembolism. Question 19. A client requests the creation of a living will. Which of the following actions should the nurse take? Schedule a meeting between the hospital ethics committee and the client. Evaluate the client's understanding of life-sustaining measures. Determine the client's preferences about post-mortem care. Request a conference with the client's family. When a client requests the creation of a living will, the nurse's priority is to evaluate the client's understanding of life-sustaining measures. Question 20. A healthcare provider is caring for an adolescent who has sickle cell anemia. Which of the following manifestations indicates acute chest syndrome and should be immediately reported to the provider? Substernal retractions, hematuria, temperature 379 C 1002 F, sneezing. Substernal retractions are a concerning sign of respiratory distress and can indicate acute chest syndrome, a severe complication of sickle cell anemia. Question 21. A healthcare provider is performing a gastric lavage for a client who has upper gastrointestinal bleeding. Which of the following actions should the healthcare provider take? Instill 500 milliliters of solution through the NG tube. Insert a large bore NG tube. Use a cold irrigation solution. Instruct the client to lie on their right side. During a gastric lavage procedure for upper gastrointestinal bleeding, inserting a large bore NG tube is essential to effectively remove gastric contents and blood. Question 22. A healthcare professional is reviewing the laboratory results of a client who has rheumatoid arthritis. Which of the following findings should the healthcare professional report to the provider? WBC count 8,000 mm, platelets 150,000 mm, aspartate aminotransferase 10 units L. Erythrocyte sedimentation rate 75 mmHg. In clients with rheumatoid arthritis, an elevated erythrocyte sedimentation rate ESR is a common finding and indicates inflammation in the body. Question 23. A client has generalized petechiae and ecchymosis. The nurse should expect a prescription for which of the following laboratory tests? Platelet count, potassium level, creatinine clearance, prealbumin. Generalized petechiae and ecchymosis can indicate a potential issue with platelet function or count. Question 24. A client has had a cast applied and a nurse is providing care. Which of the following actions should the nurse take first? Place an ice pack over the cast. Palpate the pulse distal to the cast. Teach the client to keep the cast clean and dry. Position the casted extremity on a pillow. When caring for a client with a newly applied cast, the nurse's priority should be to assess the circulation by palpating the pulse distal to the cast. Question 25. A client with vision loss is under the care of a nurse. Which of the following actions should the nurse avoid? Keep objects in the client's room in the same place. Ensure there is high-wattage lighting in the client's room. Approach the client from the side. Allow extra time for the client to perform tasks. Approaching a client with vision loss from the side can startle them and may lead to accidents or discomfort.